Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and our contact number is 76967342256. You may call us for the best OET coaching, and for any OET query, you can definitely leave a comment in the comment box. So I'm just going to start up with the topic of today, which is speaking, and this is the topic of the day. So today's topic, the most important thing is that there is a home visit. Normally we have a patient coming at our clinic or admitted in our hospital. When the patient is coming in our clinic, we say, good morning, my name is this, how may I help you? Because he's presenting to the clinic or he's coming to the OPD. If he's coming as an outpatient department in a hospital, obviously I will say, how may I help you? But if the patient is already admitted in the hospital, so obviously I will say, good morning, Mr. John. This is this is Bhupesh once again. So how are you feeling today? So means when the patient is admitted in the hospital, I say, how are you feeling today? Because I want to know what is the progress, because he is already admitted in our hospital. So I don't say, how may I help you? I would say that, how are you feeling today? And if the patient is in outpatient clinic or is outpatient department or in clinic, then I will say, how may I help you? But this is home visit. This is different. So I will say, good morning. My name is Bhupesh. I have come here too. So that is what is the first line you will say. I have come here too. So in this particular speaking, your patient is a busy 50-year-old waitress recently diagnosed with type 2 diabetes, and the patient had a wedge resection 12 days ago. So you already have a patient. The patient underwent a surgery 12 days ago. So that you have understood, and the patient is having diabetes. So obviously you can understand a lot of things up until now. Then taking it forward, uh, she has a post-operative Staphylococcus aureus infection. So she is a waitress and she had an infection on the right large toe. So basically she underwent a wedge resection, but she got an infection. And also she is having type 2 diabetes. You are visiting the home to change the dressing while the patient is resting from work duties. So that is the point, that patient was advised to take rest, and you have come to change the dressing at her home. So now the patient is under you. So it's all clear. I have understood the task. So if I have to write, if I have to complete this line, I will say, I have come here to change your dressing. How simple. I have come here to change your dressing and to see your progress. How simple. So let me speak out the whole line for you. Good morning. My name is Bhupesh. I am a nurse, and I have come to your home today to change your dressing and to see your progress. So I would like to ask you, how has it been? What are your generally habits after the operation? So the patients will say, oh, nurse, I'm not feeling really good. Then you will say, could you please tell me what happened? So whenever you want to ask any question, you always say, could you please tell me? Could you please tell me what happened? So I have come here to change your dressing and to see your progress, but nurse, I don't know, I'm really scared, I'm not feeling good. Could you please tell me what happened? Then she will say, see nurse, I think I have an infection, or maybe my wound is not doing well. There is pus formation and I don't know, I'm not feeling good about it. Okay, then you will say, calm down and relax. I'm here to help you. These are the lines which gives you marks. Calm down and relax. I'm here to help you. So before now, this is the line. These are the things you should learn. These are the most important thing when it comes to OET speaking. It is not dependent upon these things. It is dependent upon how you handle the patient. So it calm down and relax. I am here to help you only. So kya hua? Then the patient will let you know that this and that happened. So you will say, before proceeding further, so I would like to ask you some question. Before proceeding further, in this case, you can say, before first of all, or you can also say, see, it's all practical. Even if it is not given in the task, imagine a practical situation. So you will say, first of all, let me assess your wound. So then you will assess, okay. Then you will say, okay, I have assessed your wound. This line can also be used if you want to use. Otherwise, in this topic, there is no requirement practically. But if I would say, if I would be attending the patient practically, agar ye patient mein practically dekh raha hota, so I would have asked that, let me assess your wound. But in this case, we have been given a simple thing, patient general habits. So then you can say, okay, before proceeding to other things, you can also say, before proceeding further, I would like to ask you about your general habits after the operation. Now, the only word that you need to change is this. So you will say, did you rest adequately? So that is how OET, how simple OET is. Now I will speak until now. Good morning. My name is Bhupesh. I have come to your home to change your dressing and to see your progress. Nurse, I'm not really good. I'm not happy. Could you please tell me what happened? Well, nurse, you can see my wound. You know, it's really bad. It's changing its color. It's turning into black. I think I have some infection. Okay, calm down and relax. I'm here to help you only. First of all, let me assess your wound. Okay, now I have assessed your wound. And before proceeding further, I need to ask about your general habits after the operation. So did you take rest adequately? Oh, nurse, no, I did not take rest adequately. You know, I went to my workplace. I am working as a waitress. So I went to my workplace. But doctor told you to how, but doctor told you to take rest. So nurse will say, but doctor told you to take rest. Am I right? So that is how you can ask, am I right that doctor told you to take rest? Am I right? Well, yes, nurse, you are right. Doctor told me to take rest, but you know, I was having financial constraints. I had to go to my work because of my kids and everything. So we'll say, okay, but you should have taken rest. Anyhow, I would like to tell you that sometimes people get post-operative infection. So that is the only line you will seek. So this is the only problem with this task. And I have always told you, if you do not understand, agar aapko samajh nahi aa raha, please do not say anything. So simply you could have said, C post-operative reactions are C post-operative infections are common as you are diabetic. So if you don't know how to speak this line, but it is not really your fault, don't speak it. This line cannot come by itself. ये line अपने आप नहीं आ सकती. This line can only come when patient will say, it is all my fault. I went to my workplace. It is all my fault. Then you will say, no, it is not your fault. In patient having diabetes, people get post-operative infection. So please don't worry. It is not your fault. It can happen to anybody. So this has happened to you because you are diabetic. So obviously there are more chances of infection. So please do not blame yourself. It is not your fault. If patient does not blame himself or herself, अगर patient अपने आप को blame नहीं करता तो ये line मत बोलो यार इतनी सी तो this is the only thing about this topic that is bothering you तो मत बोलो फिर then you tell you then rather than speaking this point so you will say in case of patient having diabetes, there is risk of circulation problems. So basically, when you are diabetic, your blood sugar level is high. So obviously, there are more chances of infection, and also the wound healing is delayed. So there are greater risk of infection with the diabetics people, but don't speak it again and again. Don't make patient negative. So this is what I'm teaching you. That's why I'm speaking again. But otherwise, I will speak it 1 or 2 times that because you are diabetic, obviously in diabetes, there are circulatory problems and there are greater risk of infection. The blood sugar level is high. So obviously the chances of infection are low. So now, then you speak this point. Now I would like to tell you that you should follow some measures like regular dressing, which I am doing will definitely help. And also fresh hair and daily exposure to the sun can help in quick wound healing. Antibiotics have been already prescribed. I hope you are taking your antibiotics. Well, you know, nurse, no, I'm not taking antibiotics. You should take the antibiotics as prescribed by the doctor, or otherwise you can say, okay, now, or you can say now you need antibiotics because now your wound is infected. So antibiotics will play a great role in, you know, healing you. So in preventing further infection. So it is very important. So that is how you can say. Then you will talk about explain the risk of circulation problems for the diabetes. Yeah, that we have already spoken. So what I have done to make this chart easy or task easy is to merge these 2 points. Now I am giving you a brochure that contains all the information. Whether this point is given or not, ये point तो आपको बोलना ही है. I am giving you an information brochure that contains all the information. And also I would request you to call again next week to tell about your progress. तो आप अपनी progress के बारे में हमें बता देना. Please call us to tell about your progress next week. Or you can say, supply a patient brochure and agree to call again next week. Or you can say, I will call you next week. So this line particularly says that you are a nurse. So you are saying, okay, I will call you next week. So you can say, I will call you next week. Okay. So these are the things which you can modify. The major marks in speaking is about fluency. Now I will speak the whole task with fluency, and please listen to this recording again and again. Now I'm speaking. Good morning. My name is Bhupesh. I am a nurse over here. I have come here to change your dressing and to see your progress. So could you please tell me, could you please tell me, Mrs. Jones, how are you feeling today? Oh, well, nurse, see, I'm not feeling good. Oh, could you please tell me what happened? Why are you not feeling good? Well, nurse, I went to my workplace. I kind of worked over there. Doctor told me to take rest, but I did not. And that is how I think my wound has got spoiled. Okay, please don't worry. Calm down and relax. I'm here to help you. So first of all, let me assess your wound. Now I have assessed your wound, and I would like to tell you that you are having an infection known as Staphylococcus infection on your right toe. And that has happened that happens sometimes in the patient. So there is nothing to worry. We will definitely tell you the solution. But nurse, I think it's all my fault. I went to workplace. That is how it happened. Well, I must tell you that there is nothing to worry and it is not your fault. Sometimes people get post-operative infection. So it is common and it is not your fault at all. On the top of it, you are having diabetes. So in cases of diabetes, there is risk of circulation for the diabetes. And sometimes there is risk of infection as well. So being diabetic, you are at more risk of infection. So it is not your fault. Please do not blame yourself. But nurse, now I am diabetic, what to do? Let me explain you that there are many things which will help in your healing. First of all, I would like to tell you that regular attendance for the dressing is very important. Or you can dress your wound yourself, or otherwise you need to come to the clinic every day for the regular dressing. It's very important. Also expose your wound in the fresh air for some time, and also daily exposure to the sun is very important, as sunlight will dry the wound and also it will enhance healing. Are you getting my point? Yes, nurse. Okay. And also we will prescribe you antibiotics by the doctor, and antibiotics will help to dry your wound and to prevent further infection. Is it all good? Yes, nurse. Do you think I would be fine? Of course you would be fine, but you need to take rest. As you told me, you did not take rest, so you should take rest as prescribed by the doctor. And moreover, now take antibiotics, and I have given you instructions like daily exposure to the sun. All these will help in quick healing. All right, nurse, anything else? It's just about following these things. I'm giving you this information brochure, and it contains all the information what we have discussed regarding the exposure to sun, regarding taking fresh air, and for the regular dressings. So please follow the lines or follow the points written in this brochure, and I will call you next week to check your progress. Is it all good? Yes, nurse. Okay. Okay, then I'm leaving now. You take care of yourself, and I have dressed your wound. In the end, I would like to reassure you before leaving that you definitely will be fine. It is just about following the prescription of doctor, and whatever I have told you, like exposure to sun and all these things, will be really important. Are you all good? Okay, I'm leaving now. You take care of yourself and wish you a very speedy recovery. All right, nurse. Thank you. Okay, take care. Tata. Thus, that is how you speak. So this is the way to execute your role play. Again, please keep trying, keep speaking. So this will really help you to become better. So in the end, reassure karna. रीएश्योरिंग इज वेरी वेरी इंपॉर्टेंट इन द एंड. रीएश्योरिंग के बिना मार्क्स पूरे नहीं होती. ब्रोशर देना वैसे भी जरूरी है, चाहे वो दिया हुआ है चाहे वो नहीं दिया हुआ. Please listen to this recording 2-3 times for better satisfaction. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.